So welcome everybody that's joining. Really glad that you could make it today and able to attend our session on monitoring safely managed water and sanitation services. We'll just wait a little bit longer because there's going to be hopefully quite a few of you today. And if you'd like, please feel free to enter your name and where you're from and your work or organisation into the chat, and so we can see who's joining us today. Great. We really appreciate lots of people are joining at different hours of the day. I think it's quite late in the day for lots of people in the Pacific. So thanks for fitting this in, and look forward to your participation in this workshop. And for anyone that's just joining now, feel free to put your name and organisation into the chat so we can see who's joining us. We've got people from all over the place at the moment. Australia, Laos, Bhutan, fantastic, Nepal. So I might just leave another minute just to have a few more people joining us. Great, welcome everyone that's joining. As you can see, people are putting their names into the chat and organisations, so we can see all the different participants on today's call, which are from all over the Asia Pacific region. So it's great to see everybody. So we might just wait one more minute. We've got quite a few extras coming in now, and then we'll get started. We've got quite an action-packed agenda today, lots to fit in, different presentations from this Waterfallman project. So hopefully with lots of interesting content for everyone. Great, I'm expecting it's quite late in Vanuatu. Thanks to everyone that's joining from different parts of the Pacific, all the way across Asia. Okay, we might get started if that's okay, Emily. So just firstly want to welcome everybody and very much thank you for joining this workshop. The high participation numbers hopefully highlight the interest and importance in this topic of monitoring safely managed services. My name is Freya Mills. I work at the University of Technology Sydney in the Institute for Sustainable Futures, and I've worked on this Waterfallman project alongside my colleagues Juliet Willits and Avni Kumar. So we've got a really interesting agenda for everybody, starting off with some introductions to the webinar from Peter O'Connor from DFAT and Rick Johnston from the World Health Organization, who co-leads the joint monitoring program. Next, we'll present what this work is based on, which was a synthesis and case studies of Waterfallman projects and how they've been monitoring safely managed water and sanitation services. After that, we're lucky to have two representatives from government to really discuss how they're progressing monitoring of safely managed services at both a local level and a national level, with Winnie Sagan from Papua New Guinea and Aisha from Indonesia. Lastly, we'll have a panel discussion with some of our participants and Waterfallman partners, and that will allow the audience to ask questions directly to the panel, which you can put in the chat throughout the presentation. So firstly, I'll hand over. Unfortunately, Peter O'Connor wasn't able to join at last minute, but he's been able to send a recording to open this webinar. So Peter O'Connor is the Director of Water Security Section, Climate Change and Sustainability Division of the Australian Department for Foreign Affairs and Trade, DFAT. So Emily, if you could start that presentation, it would be great.
Hi, my name's Peter O'Connor. I'm the Director of the Water Security Section at the Australian Department of Foreign Affairs and Trade, or DFAT. On behalf of DFAT and the Water for Women Fund and the Institute for Sustainable Futures at the University of Technology, Sydney, and all our partners, welcome to this important session with the very long title of Monitoring Safely Managed Water and Sanitation, Experiences in Asia and the Pacific, Lessons from Water for Women. I'd like to start by acknowledging the traditional owners of the lands on which I work and live, the Ngunnawal people. The Ngunnawal people have lived in and around this region since time immemorial, caring for the land and the waters that now sustain the city of Canberra. The Ngunnawal people continue today to be an important, essential part of the fabric of Canberra, Australia's national capital. I pay my respects to them and their culture and to their elders past, present and emerging. We're delighted to have so many people participating in this webinar today. Thank you all for joining. Water for Women is the Australian Government's flagship WASH program. It's delivered as part of Australia's International Development Cooperation Program with an investment of about 120 million Australian dollars over 5 years. The Water for Women partners with civil society organisations and research institutions to deliver 20 WASH projects and 13 research initiatives in 15 countries across the Asia and Pacific region. The goal of Water for Women is to improve the health, gender equality and well-being of communities through inclusive and sustainable WASH. This, of course, aligns with SDG 6 and its related targets. SDG 6.1 and 6.2 call for universal access to WASH services by 2030. The targets also establish ambitious indicators that go beyond the types of facilities people use and introduce additional criteria for different levels of service provided. The highest level criteria is, of course, safely managed water and sanitation. The concept of safely managed water and sanitation extends beyond access just to improve sources and facilities. It requires that we consider the quality and the comprehensive nature of the services to ensure not just public health, but environmental outcomes. Measuring, recording, and compiling the sort of data necessary to measure safely managed services is critically important, but it's also not easy. Each country presents its own challenges. Data collection needs to be tailored to data sources and types of services. New skills and capacities are needed to support improved monitoring of safely managed services and to encourage a culture of data use in policy, planning and implementation. The World Health Organization and UNICEF's Joint Monitoring Program, or JMP, is responsible for the global monitoring of SDG targets 6.1 and 6.2. What the latest JMP, Joint Monitoring Program report for 2020 tells us is that there continues to be large gaps in the data for our region. Data for safely managed services for water supply were not available for the Oceania, Southeast and East Asia region, and gaps remain in monitoring of on-site sanitation. The Oceania region is the only region in the world that lacks data on both safely managed drinking water and sanitation. I'm proud to be able to say that Water for Women is helping to close the gaps. Across Asia and the Pacific, Water for Women partners are leveraging their WASH projects and research to test and adapt tools to monitor safely managed services and support national and subnational monitoring systems to report against SDG 6.1 and 6.2. Under the Water for Women program and under the leadership of Professor Juliet Willits, the Institute for Sustainable Futures has led a dedicated research and learning initiative to help us close these gaps. We're delighted and proud that Water for Women can contribute research and knowledge to the sector and have an opportunity to discuss the challenges and open the dialogue with you all today. So, very big thank you to all the Water for Women partners who have contributed to this important initiative. Thanks to Julia of the Institute for Sustainable Futures for her leadership of the project, and to the International Water Centre of Griffith University. Thanks also to our civil society organisation partners, SNV, IDE, WaterAid, the Centre for Advocacy and Research India, Thrive Networks and Habitat for Humanity for their important contributions. Also thanks to Rick Johnston from the World Health Organization, the government of PNG and Bappenas, Indonesia for their presentations in this webinar. Today's session is designed to be a two-way discussion. I encourage you all to join in with the presenters and panelists during this webinar and in future dialogue as a sector. I'd like to now pass to Rick Johnston from the World Health Organization UNICEF Joint Monitoring Team for the introduction on monitoring the water and sanitation of SDGs. Thanks, Rick.
Hello, everyone. Thanks. My name is Rick Johnston, and I work at WHO Geneva, where I co-lead the WHO UNICEF Joint Monitoring Program. This is a joint program since 1990, and we previously reported on the MDGs and are now responsible for global monitoring of SDG targets related to WASH. If we could move to the next slide, we see that since 2015, we've added WASH in schools and WASH in healthcare facilities as part of the 2030 Agenda for Sustainable Development. And we start with monitoring guidance about what kinds of questions and global indicators we recommend to include in surveys or national monitoring systems. And if you click, then we collect national data and match it to those global indicators and update the global databases every 2 years. We do households in odd years, and this year we're just working on schools and healthcare facilities because it's an even year. Now, on the next slide, you can see that we build on those core questions and indicators and use what we call service ladders to benchmark and compare progress, of course, across countries. And if you click, we can see that for SDG 6.1, there are these three principal indicators: safely managed drinking water, safely managed sanitation, and basic hygiene. And safely managed drinking water is about more than just having an improved water source. It's having that water source located on premises with water available when needed and free from contamination, safe to drink. Likewise, for safely managed sanitation, it's not just having a toilet, but making sure that excreta are safely managed along the whole sanitation chain. And as Peter mentioned, the SDGs set a high level of ambition of universal access by 2030 to these service levels, though each country is also encouraged to set their own national targets, which might be less than 100%. If you click, you can see that we also have global indicators for lower levels of service, including basic water, sanitation, and hygiene services. And those are used to track SDG target 1.4, which is about universal access to basic services, including WASH. Then we also monitor lower levels of service, including people who have no services at all and take water directly from surface water or practice open defecation. On the next slide, you can see that we use these same ladders and those colors also to compare service levels over time and across countries. Here you can see that most countries in the East Asia and Pacific region lack nationally representative estimates on access to safely managed drinking water services, which is shown in the dark blue there. There are only 6 countries, and not including China, which is about 2/3 of the population in the region, with enough data to have national estimates. So we don't have a regional estimate for safely managed drinking water. We'll only do that if we have enough countries, with actual data. And we find that most countries that don't have sufficient data are lacking national information on drinking water quality. The next slide shows a similar situation for safely managed sanitation services, where we can see some progress. Yet most countries in East Asia and Pacific still lack nationally representative estimates on access to safely managed sanitation services. That could be because there's not information about wastewater treatment and centralized treatment plants, or about management of on-site sanitation systems such as septic tanks and pit latrines. But you can see on the column on the left there, that's China, where you do see impressive progress with this big sloping upwards from 2015 to 2020. So we do have a regional estimate for safely managed sanitation for this region. The next slide shows, though, that these national statistics are averages that hide inequalities. So we also try to highlight differences among regions or different types of households. And here we're showing basic sanitation by the wealth quintile. And you can see that in a few countries like Maldives and Thailand, all 5 quintiles have basic sanitation. But in many other countries, the richest 20% have nearly universal coverage, but the less wealthy have much lower levels of coverage. And in some countries, the gap between the richest and the poorest is really massive. Next, I want to share quickly a few slides about rates of progress in different regions. And you can see the countries on the left here, and the kind of acceleration that would be needed to reach universal access by 2030. So Eastern Asia and Pacific, let's start with that. It's a big region, 27 countries, over 2 billion people. So again, China alone is about 2/3 of that population. And here what we're showing is these lines show the status in 2015 and 2020, and then what would happen in 2030 if current rates of progress hold, and the level of acceleration that would be needed to bring us up to 100% by 2030. So here you can see that basic services are on track. You see that 1x means that that rate is the right rate to get to 2030 and 100%. We don't have a regional estimate for basic hygiene because we're lacking data from China, and the same for safely managed drinking water. But we do have safely managed sanitation, and the progress is good, but would need to double to reach 100% by 2030. Next, let's look at South Asia, another big region with just under 2 billion people, 3/4 of them in India. And here we can see that basic sanitation, open defecation are on track to be eliminated before 2030. Basic drinking water coverage is quite high, but progress would need to double to reach universal access by 2030. And there's no regional estimate for safely managed drinking water here either, because we don't have national drinking water quality data from India. But we do have data on safely managed sanitation, and progress there would need to triple. And basic hygiene, that's just having hand washing facilities with soap and water in the home, would need to quadruple. Next, let's zoom in to Southeastern Asia, which has 11 countries, about 670 million people. And we don't have China here, so we can, they kind of dominate the regional estimates. But even in this region, all the basic services are on track: water, sanitation, and hygiene. But coverage is lower and progress is lower for safely managed sanitation, where rates would need to be 5 times faster, and even slower for safely managed drinking water, where progress would need to accelerate by 12-fold to reach 100% by 2030. Turning to the Pacific, including 15 Pacific Island states, 11 million people, about 3/4 of them in Papua New Guinea. Coverage is lower, rates of progress are lower, and we don't have regional estimates on safely managed drinking water or sanitation, but we do have basic hygiene. But the thing you see here is that all of the lines are pretty flat. Basic drinking water would need to accelerate by a factor of 12, basic sanitation by a factor of 125 to reach universal access by 2030. Again, one country is driving these, Papua New Guinea. So if we look at the region without Papua New Guinea, we see a slightly different picture. This is on the next slide now. Here we have about 2.5 million people. We lose the regional estimate for basic hygiene, and we see basic sanitation and drinking water coverage is much higher, but the rates of progress are still very slow. So sanitation progress would need to be 8 times faster, and elimination of open defecation 16 times faster to reach universal coverage. And we actually see a slight negative trend for basic drinking water. So let me just conclude by saying that there are a lot of data gaps. SDG baselines are missing from many countries. Some of the trends might be explained by poor data availability. But there are also examples of countries in the regions taking steps to progressively improve monitoring systems. First, you can collect more information through household surveys. You can collect now information on drinking water quality, management of on-site sanitation and hand washing. It's better to adapt an existing survey like a mix than to create a new one in general. But you can also adapt routine systems like surveillance of drinking water quality. The Philippines are doing this. Malaysia has a nice system for surveillance of wastewater that includes on-site sanitation. Indonesia has public health inspectors that are piloting looking at sanitation as well. So these types of systems are longer term or at least midterm projects. They take more time to get set up and moving, but when they're in place, not only are there more reliable data for SDG reporting, but more importantly, countries have more reliable data on hand to inform their own policies and plans and take steps not just to measure, but also improve services where needed. Thanks very much. I'm looking forward to the rest of this webinar.
Thanks very much, Rick. I'll now present some findings and details from this Water for Women case study. Now that we've seen the status of water and sanitation SDGs, thanks to Rick, and also some of the monitoring challenges presented by both Rick and Peter, I think it's useful just to remember the reasons for this higher and more complex level of safely managed services. The SDGs, and these SDG 6 targets in particular, were developed to better consider the human right to equitable access to water and sanitation services, to reduce health risks, protect the environment, and ensure sustainable services for all. Given the high burden of disease attributed to poor wash, it is important that we aim to reduce health risks at both the household level by achieving the drinking water criteria of free from contamination, and also reducing health risks in the community by ensuring that excreta is being managed by the 3 pathways for safely managed sanitation and not discharged untreated to the environment. Achieving safely managed services may seem like an ambitious objective for some countries that have not yet achieved basic access. However, striving for this level could permit households with lower service levels to leapfrog to safely managed services. Next slide. With these increased levels of service provision is the need for additional data. And despite being halfway through the SDG period, we saw many countries still lack adequate data for estimates of safely managed services. The table right shows data gaps for drinking water from the JMP report. For drinking water, water quality data is a major gap in the region, a necessary criterion for the SDG estimates. While for sanitation, there is a major data gap for emptying and treatment of excreta from on-site sanitation facilities. While monitoring is necessary for reporting on the SDGs, which most countries have committed to, monitoring is also critical to identify gaps or inequalities in services, justify increased investment, prioritise activities, and allow for course correction. Next slide. Now diving into this learning initiative that as was introduced by Peter. The aim of this work was to consolidate the knowledge generated by the partners through their Water for Women projects and research to inform broader efforts to improve monitoring safely managed services in the region. 8 Water for Women CSO and research partners were involved in developing this output through case studies and monitoring safely managed services and a number of workshops. Some of these case studies will be shared today, while others, you can see the inputs from others in the case study and synthesis reports we'll link to at the end of this presentation. And thanks to Emily's link to it now. So moving on to the next slide and the key considerations for monitoring safely managed services in this region. I'll first focus on the monitoring methods, the first step of which is to align global indicators to the local context. A common finding across the case studies was the need to consider the additional indicators beyond the JMP core indicators in order to capture the contextual factors into delivering services that protect public health and reduce risk to tolerable levels. A key consideration for this region is to include indicators to adequately understand the seasonal variations which affect water source, availability and quality. IWC's assessment of the differences in safely managed drinking water between wet and dry season highlights this issue, as capturing this data without knowing the season makes interpreting the results difficult. For safely managed sanitation, SOV and IDE considered emptying frequency and sludge depth as important expanded indicators for building awareness of safe and sustainable management of sanitation facilities. Next slide. The type of water supply sources and types of sanitation facilities and services also influence what methods and indicators are most suitable to monitor. For these regions, most households rely on non-piped or distributed water and sanitation services. These require different monitoring approaches and indicators and pipe systems, and often lack administrative or regulatory data and relying more on data from households. Risk assessments, such as water safety plans, were useful in informing monitoring priorities and identifying how the collected data can be acted upon. And next slide. Lastly, creating an enabling environment was critical for the monitoring of safely managed services to be integrated into national monitoring systems. CSO and research partners supported various activities to build awareness, identify and bring together stakeholders, and build capacity. Many partners engaged government staff in the implementation of monitoring, as well as the analysis and use of data. Capacity was built through their use or supervision of different tools, and awareness of the importance of the safely managed services increased as they saw firsthand the conditions in the field or had the first set of data on safely managed service levels. As can be seen in the upcoming presentations, these activities can take place at local scale or regional or national scales, all contributing knowledge, skills and methods to support the progress of safely managed sanitation services. We're now fortunate to have a presentation of some of the case studies and then followed by a presentation from the government. So I'd like to introduce Rosie Sanderson, Project Officer from the Water and Sanitation and Hygiene at the International Water Centre, who will present work on monitoring in Solomon Islands. And just a note for everybody, please put any questions that you have for me or any of the other presenters into the chat, and we'll be able to discuss these at the end of the workshop. Thanks, Rosie.
Thanks, Freya. Good afternoon, everyone. My name's Rosie Sanderson, and I'm here on behalf of my colleagues at the International Water Centre at Griffith University, Regina, Mark, Sachita and Kara, as well as the wider project team at the Solomon Islands National University, who helped in preparing these case studies. So I'm joining you today from Meanjin, otherwise known as Brisbane, where I'd like to acknowledge that sovereignty here was never ceded by the traditional owners of the Yagara, Turrbal and Quandamooka people, and I pay my respects to their elders across all generations. So I've got a few very brief minutes today to share a couple of insights from our case study, and this is based on our applied research work in Melanesia. So in Melanesia, data for SDG 6.1 and 6.2 are mostly gathered through national censuses and household surveys, largely due to such a large proportion of people living in rural areas. And we have a context with large geographical and linguistical diversity and challenges around accessibility to do with all of the archipelagos and the different rural contexts there. So across Melanesia, water quality monitoring remains a challenge. So that was highlighted by both Rick and Freya. And this contributes to mostly insufficient data needed to properly estimate coverage of safely managed services at national or sub-national levels across Melanesia. The case studies today will focus quite squarely on Solomon Islands, where our projects were based. Next slide, thank you. So using objective measures for wash service delivery is obviously very useful. And so we incorporate the measurement of SDG 6.1 and 6.2 into most of our applied research projects using the JMP guidance for households alongside additional preference and wellbeing considerations and indicators. So the two Water for Women projects we've discussed in our case study are the Pacific Community Water Management Plus project, and our study of behavioural determinants and options for interventions for child faeces management in rural Solomon Islands. Next slide, thanks. So in both of these projects, through assessing SDG 1 and 6.1 and 6.2 levels using those core JMP questions, we determined that additional information, some of which are covered in the expanded JMP questions, are pretty necessary to accurately assess whether the wash access in these communities is in fact safely managed. I'll run through a couple of key examples, and Freya touched on seasonality. This is a really key one, and it's not addressed in the core questions. We find it in the expanded indicator set. Now, our data showed that in some villages, there was quite large drops in access to safely managed services between the wet and the dry season. Of course, we do recognise and acknowledge that these are pretty small data sets that we're presenting here, but the patterns are repeated again and again across communities and countries in Melanesia, as well as other highly seasonal places. And it's a particularly relevant point in the face of climate shocks and a changing climate that we're seeing. Next slide, thank you. We've also been assessing SDG 6.2 service levels as part of our exploration of child feces management in rural Solomon Islands. And what I want you to focus on here is the rate of open defecation in these households. To the right of the graph, the legend's a little hard to see at this resolution, but when you include households that tend to flick their young children's poo from the yard over the fence and into the bush, or take their 3-year-old to the mangroves for number 2, as a few examples of what we see, the rate of open defecation clearly increases. The management of child stools is another expanded indicator question in the JMP guidance. Next slide, thank you. So I would argue that some of these expanded indicators and the additional information, including the ones I've mentioned, are not overly onerous to include into data collection efforts, though the difference they make to really understanding people's access to safe wash is pretty substantial. However, of course, in doing this, we should recognise there's the potential that we aren't comparing like with like. So if national statistics are reporting a proportion of safely managed services that do not explicitly consider seasonality, as an example, and a project team finds something different by including seasonality, there's a potential miscomparison there. So therefore, we think it's really important to be very clear about exactly which indicators, which questions, core or expanded or otherwise, are being used to prepare WASH assessments. We have some other recommendations and details on our case study. I'd once again like to thank all of our partners in this work, as well as Water for Women and the Pursuing Safely Managed WASH team for their continued support. Thank you very much.
Thanks, Rosie. Fantastic presentation and really clear importance of those indicators for your work and others. I now introduce Ujin Rinzin, the project leader from SNV Bhutan, to present their case study.
Hello, everyone. Greetings from Bhutan, and many thanks for the opportunity to present our case study through this forum. I'm Ugen and WASH project leader for SNV WASH in Bhutan. I think the case study focuses on the process of embedding safely managed sanitation monitoring in the government system in Bhutan. And SNV has been a partner to the government to develop a national sanitation and hygiene program since 2010. And the program is based on the SNV's Sustainable Sanitation and Hygiene Program model. Government of Bhutan is highly committed to sanitation and hygiene improvement, safely managed sanitation in the country, and has aligned its plan with the Sustainable Development Indicators. The national target is to achieve open defecation free with 100% access to safely managed sanitation by the end of this year. In 2020, 84% of the rural population had access to improved sanitation. However, there was no monitoring tools and database for safely managed sanitation, and actually hence lacked national baseline and target for safely managed sanitation. In the process, we know that monitoring data provide evidence that can guide the planning and investment needed to achieve government's safely managed sanitation commitment. And to progress this, we undertook some key steps towards establishing baseline, setting target, and also strengthening the existing monitoring system. Actually, these steps involved national level stakeholder consultation in 2017, which is supported by WHO Joint Monitoring Program in terms of aligning national baseline with SDG WASH indicators, and also identifying database data gaps. And in 2018, with support from SND and IRC Netherlands, generated a rural sheet flow diagram using available national and program data, and also the field knowledges. It revealed that about 39% of the fecal waste in rural Bhutan was safely managed. Further, a study tool was developed for safely managed sanitation, and also it was tested at the program level, but it has not been able to integrate within the national monitoring system. Next slide. However, while efforts have been made, there are some challenges of integrating into national monitoring system. Being safely managed sanitation is relatively new concept in Bhutan. And also, while survey tools and approach has been developed, it takes longer than expected to harmonize and integrate into national monitoring system. Also, since any change or integration of national monitoring system happens only after every 5 years. So it has been a challenge. And next slide, please. Now from this case study, we have some key messages. Like applying risk-based assessment can help decision makers to identify priority issues and inform safely managed practices. This is one. Another one is valuing available national and program data and the field knowledges in absence of national representative data on safely managed services, basically to inform national assessment and the target setting. And finally, embedding and harmonization of safely managed services into national monitoring system is a long-term process. And of course, like we need to keep pursuing. And with this, I think it's a brief case study sharing from Team Bhutan. Thank you so much.
Thanks very much, Eugene. That was a really interesting presentation of the progress and remaining challenges for monitoring in Bhutan. I'm happy to now introduce Winnie Sagan, the Senior Environmental Health Officer of East Sepik Provincial Health Authority in Papua New Guinea, to present their efforts on monitoring safely managed services. Thanks, Winnie. Hopefully Winnie's connection is still there. Yep, go ahead.
Yes. Hello, everyone. Greetings from Papua New Guinea. And first, I would like to say thank you for the opportunity for me to present and share the experiences of Waterfallman Project implementation in Wewak district of Papua New Guinea. Thank you. Next slide, please. Firstly, just a brief profile of Wewak district. It is one of the 6 districts in East Sepik province within Mamasa region of Papua New Guinea. The district is made up of 5 rural and 1 urban local level government council, with Wewak town being the provincial capital of East Sepik province. We have an estimated population of roughly 98,000 people. 71% of these people live in rural areas. Wewak District Development Authority, or Wewak DDA, together with East Sepik Provincial Health Authority, where I'm working with, and the District WASH Committee are responsible for WASH services in the district. Our district is categorized as one of the remote districts with poor road conditions and poor infrastructure development. which serves as challenges for us to monitor waste services in the district. Thank you. Next slide, please. Waterfallman Project started in 2018. As you can see on the map, in 2018, waste monitoring process were very weak, or shall I say there was no monitoring for waste in the district. There were limited information on what communities and institutions that have access to water, sanitation, and hygiene, and the level of waste services that are provided. Therefore, there was lack of data and evidence for DDA, LLGs, and Provincial Health Authority to prioritize which schools, communities, and public institutions like healthcare facilities for us to work on. The district needed a good data to form a 5-year development waste district plan. Next slide, please. So in 2018, there was no monitoring of waste services. I mean, prior to that, so there was no data collection done, and there was limited budget for monitoring of waste activities. Work District have been using the National Waste Monitoring System since the Waterfallman Project started in 2018. The database is administered at a national level by the Department of National Planning and Monitoring. Data were collected using a M-Water application. Data were collected by government offices, the LLG offices, project offices, and Provincial Health Authority, environmental health offices. And they were collected from communities, schools, and healthcare facilities. This data were then extracted to form the 5-year work district plan, which guide us to implement the project. So the 5-year work district waste plan outlines the priority projects for which the service delivery is taken. So low access to waste services across the district means provision of basic services is prioritized rather than safely managed. Monitoring of waste activities were jointly done by LLG officers and our office, environmental health officers from PHA and water aid staff. The monitoring targets the project delivery sites at the rural communities and the schools and healthcare facilities where we are working. A project baseline and inline survey is undertaken using the DNPM standard forms indicators captured under the SDG levels. Next slide, please. So you can see the process for joint monitoring of our priority projects in the district. The priority project started with selection from the district waste plan. A baseline study is done, or survey is done using rapid waste at the household level to determine the number of households in that project area. Using the data, a technical design is done, and then the implementation is done based on the household survey or data collected from the rapid wash. After that, the implementation started with the progress monitoring of and consultations with the community on sanitation and hygiene. So what we are doing is when the infrastructure, water supply infrastructure is going on, our team are also monitoring on sanitation and hygiene behavior change in that particular community. So after when the implementation or the construction of the project is done, we go back to do inline data collection to see or measure the changes during water supply construction and after the construction to measure the household with the number of toilets and hand washing facilities. So the work district was coordination body or committee is the key decision-making body that we meet every quarter to discuss on issues relating to the project. The data that we are collected during the monitoring visits includes the equity and inclusion services. Our aim is to adapt and improve the approaches to inclusive and resilient WASH service delivery in the district and also in the province. Thank you. Next slide, please. So the DNPM or Department of National Planning WASH MIS does not display the SDG levels for households. It only has the information for schools and healthcare facilities, not for the household. So WeWork district uses the rapid WASH household survey that was developed by WaterAid, and the training was done to the district WASH coordination body and the environmental health officers to go out and collect baseline and inline data on the household. So as you can see on my right, there's a display of the kind of data that is for the community level, which rapid WASH captures during baseline and inline survey. So the information provided by DNPM is only for healthcare facilities and schools. So there's nothing about the household. But with the current system that we use in rapid WASH, it does give us information on that. And the data provides evidence for the district WASH coordination body to assess the performance and the impact of the project that is currently going on. Next slide, please. May I have the next slide? Thank you. So what some of the challenges and improvements that we want to see? So we would like to see the monitoring currently done. That is only for public sector service delivery, but not others like private sector. There was no recurrent monitoring access across the district due to cost, limited number of staff, and remoteness of the villages in the district. As we can see, monitoring in PNG can raise expectations from community, and this needs to be managed carefully. So when we asked to go and do monitoring of WASH in the community, in the rural communities, they're expecting that we are going there to provide the WASH services. So it's quite challenging for us to do regular monitoring at the community level. The process needs more coordination with what councillors and the community leaders. There is need to prioritize access to MIS for all LLG staff and our PHA officers, and a need for regular refresher training for district WASH coordination body members. Thank you. Next slide, please.
Thanks very much, Winnie. That was a fantastic presentation. And really interesting to see the tools that you used and also the progress that was made in just a few years, and also some of the implications of monitoring on community perception. So thank you very much. I really appreciated that. We'll now pass over across not far from PNG to Indonesia, and to Nur Aisyah Nasution, a senior planner from Water and Sanitation at Bappenas, the National Planning and Development Agency in Indonesia. Thanks, Aisyah.
Thank you, Freya. Good afternoon, everyone from Indonesia. I am Aisyah, and thank you for this opportunity to share the result and also the journey of Indonesia to monitor, to have a better monitoring for the safely managed water and sanitations. Next slide, please. So this is a glance of the story of Indonesia when we first tried to how to monitor the safely managed water. It started in 2015 in one of the provinces in Indonesia, that is Yogyakarta. So it is a collaborative effort from Bappenas, the Statistical Agency, Ministry of Health, and also supported by UNICEF through what we call it SCA or Water Quality Survey in Yogyakarta. We have a more clearer methodology and how to monitor or how to survey the safely managed water. And we found that in that province, the safely managed water access is 8.5. And through the years up to 2019, finally we arrived that we can adopt that what we have built in Yogyakarta as a national survey, what we call it SCAM or Survey Kualitas Air Minum. So we adopt the methodology with some of refinement of the concept and methodology. And on 2022, we finally can have a national survey for the safely managed water. So it is implemented in 34 provinces. But since it was during the COVID pandemic, so we have to kind of like cut off some of the budget. And that's why we only have a national figure. So we do not yet have a achievement or the access in the provincial level. We only can capture the national level data. And in 2022 also we already published on the result. It is 11.9, the result of the safely managed water in Indonesia. Maybe next. So this is what we done in our national survey data. So we tailor the methodology so it could be standardized and compared to the GMP method, while also can capture what we already agreed as a national indicator for our SDGs. So the biggest differences between GMP and Indonesia concept for the safely managed water is on the treatment for the bottle and refill water. While in Indonesia, we do not acknowledge it as improve access or also the safely managed water access. That's why through SCAM, we try to capture both. So for the global purposes, we still can have data that can be compared globally, but also for the national level, we have a data that can fit with our concept and methodology. So it is a household survey data across 34 provinces, and we also agreed on the parameters that we have to monitor in the survey and also nationally. So it is quite a lot of discussion what parameters, especially in terms of chemical parameters that need to be monitored nationally, and also like how we finally arrive and can measure the safety level in each type of technology that we have in Indonesia. So it is around 25,000 household. And the instrument is through questionnaire, calibrations, and also testing of the drinking water sample. It is helped by the local health authority. It is done during the 2022. And then we, based on that method, we also adopt what we have in this national survey into our surveillance system. So last year, we also use this method in the 34 in 34 district or cities. So we also already have like a more detailed data at the cities or district level, but only for 34 district or cities. We have around 520 district and cities. So it is still a long way to go to have a more detailed data at the cities and district level, but we already have the national figure. So it is a better progress from our perspective. Next slide, please. So this is the result of the data. So we found many, evidence, and also think maybe that we can need to move forward. In terms of the pollution risk level, we finally have a strong evidence that the pipe water is the safest technology to achieve safely managed water. The second one is the bore pump. So this is also become, discussions among government and also the non-government parties in Indonesia, how we treat or how to manage households that do not have access to the pipe water. In Indonesia, we only have 20% household that have pipe water. So 70% is still relied on the non-pipe water sources. So how up to 2030, we have to deal with that kind of issues. And the second one on the household scale treatment, we in Indonesia, mostly household boil their water, but we do not, we also think that boiling is maybe not enough. So what we have to do afterward, after we have this figure on the household treatment, household level treatment system, and then on the distribution of drinking water source, this is something that really also need to be managed by the government. We have like 40% household that relied on the refill water and the bottled water as their primary drinking water source. This condition is really, trigger much discussions, like how some parties want to acknowledge this refill and bottled water as the access, but from the perspective of the government, the refill water and the bottled water is not sustainable, and how they already also how the exploitation goes in the upstream level. That's why we want to make sure that gradually all households in Indonesia can use one sources, even though now we are still relying on refill and the bottled water. And for the latter, we found that for the improved water access, it is around 93%, and the safety level and the safely managed water access is around 11% in Indonesia. And it is quite robust, because on those 34 districts that also already adopt this system, we also found the safely managed level across those 34 districts is around 11%. So maybe that's our national figure. And the last evidence that we also found, there is differences between the quality of water between point of access or point of collection and point of use. This is something that really we talk, especially with the Ministry of Health, how to trigger the community awareness and in their household in terms of treatment, and also maybe talk about the technical standard of the piping under household. In Indonesia right now, we haven't yet, we do not have any regulation or policy to ensure that the piping system under household is also important to achieve the safely managed water, especially through pipe system. So what we can see here, this is not a detailed data, but if we make it more detailed, especially for each type of technology, some of the technology, it is better on the point of access compared to point of use, but some it's better in the point of use. So it is still need a better data to know or to diagnose what actually become the issue. But I think we think that the household behavior is also important. Next slide, please. So what we learned from the national survey through SCAM, it is we now have the baseline. We are confident how to forecast our target up to 2030, what policy we need to develop, and what kind of monitoring system at the regional level that we need to develop. And of course, like how we need to strengthen our surveillance system, like through water safety plan and also the quality monitoring data. Next slide, please. So this is our way forward. So we will do this national survey at least a minimum once every 3 years or at least once every 5 years. This is still a discussion, but we already have agreed that we need to have it to make it as a routine national survey. Adaptation to our surveillance system for the provincial and district level. This is also the way forward. And also this next step is also ensuring all the water providers and the local government also measure their quality water system. And then last one is that we are now also developing, is we already initiate a piloting how to have us on-site safely access. We realize we need a more detailed surveillance or safely managed sanitation access in Indonesia, because 80% of Indonesian households still rely on on-site sanitation, while on the other hand, 70% of households also still rely on the non-pipe system. So these two things, on-site system pipe and non-pipe, need to more accurate data, so we can assure that the safely managed water and sanitation can be achieved properly. And maybe the next slide, because this is also a big issue in Indonesia. This is actually the disparity level of the water. The above one is water, and the other one is for sanitation. We see quite a lot disparities between each decile, but not yet. This is only for the improved access, not yet for the safely managed water. So this is also the way forward that we need to develop at the national level. Maybe that's from my side, Freya. Thank you so much.
Thanks so much, Aisha. That's fantastic. And stay with the video on, because I think you've just introduced a fantastic transition to the panel discussion, and which I think Juliet will be speaking about, these inequalities that you just mentioned. So I'd like to introduce Juliet Willits, Professor, Research Director at the University of Technology Institute for Sustainable Futures, who will lead this panel, along with Rick Johnston from World Health Organization. Aisha, thank you again, and Gabrielle Halcro from SNV. So Juliet will lead discussion. Please keep adding some questions into the chat, and she'll try and incorporate those into the panel. Thanks, Juliet.
Thank you, Freya, and welcome Aisha, Rick, and Gabrielle. So we might just start with a focus on inequalities, which is where Aisha left off, and particularly because the Water for Women Fund has a strong emphasis on gender equality and inclusion. And so thinking about when we consider safely managed services, how monitoring can reveal inequalities in access to that higher service level. So perhaps just starting with a question to you, Rick, from a JMP perspective, what would you see as the most important steps to consider inequalities in monitoring safely managed services? And is there any particular support or advice that JMP has for countries to consider this aspect?
Thanks, Julia, and thanks to all the presenters. I really enjoyed those case studies. Yeah, I think for inequalities, I mean, it really ties back to what the data collection method is. And if you're collecting data from a household survey, as in this very nice example from Indonesia, then you have all kinds of potential to look at the characteristics of the household. It's harder to look within the household to see, like, for instance, if men and women or older people and children are having different access, but at least households, you can look at the wealth, you can look at the ethnicity and other household characteristics. Again, like this very nice example from Indonesia. But some of the information needed for safely managed services typically comes from administrative data sources or things that are collected at a larger scale. For instance, wastewater treatment plants, or often drinking water quality comes from, a service provider or a regulator. And then you can't disaggregate to, household characteristics, but you can often look at regional differences. So again, if you can collect that kind of data at the local scale, that can be aggregated up for a national picture, but still valid at district or municipality level, then you can see some interesting inequalities based on geography.
Great, thank you, Rick. And yeah, there are useful points of how we can have insight even if we don't have that household level data that's where inequalities are so obvious. So maybe coming to you, Aisha. So as you described, there are quite obvious inequalities in Indonesia, and it would be good to hear just a little bit more about the national government's approach to responding to that kind of data. And also, I will just add in, because there was one question in the chat, and this is to encourage others, if they have questions, to add them to the chat. There was a question about your sample size for your very huge 25,000 data collection for water quality. So if you could also cover off on how you came up with that sample. But first, maybe start with the inequalities and the government's response.
Yeah, thank you, Juliet, for the first question. So how we deal for the inequality data. So we also tailor especially on many financial policy to address those inequalities. But again, we only have improved data services for inequality. We haven't yet have the data for the safely managed water. Right now, that's why I came a bit late, because water.org also have kind of this webinar with in the region level. So one of the things that we are now developing is the microcredit. How for with this scheme we can better address especially household that have the poor household. And then in Indonesia right now, many things it's really rely upon the government budget. And we want to move forward, like how the government budget will focusing only for the big infrastructure. Well, for the downstream level, it may be like we create many facilities that can, used by the household. So I think that's one of the things that how we now address inequalities. And also in existing our instrument or program, like through grants that also DFAT already help us, and also microcredit or the national government budget, we also make what we call segmentation. So for the money that come from national government, which decile will be the target. For the grant money, output-based grant, which community that will be targeted. So we ensure there is no overlapping in terms of beneficiaries of each program and the financing that we already have or will tailor in the future. So that's in terms of inequalities. And also on the sample size, yes, it is a big number, but for Indonesia, unfortunately, we are quite a big country. We have 270 million people. So that sample still cannot capture what is happening in terms of in the regional level, and where the sample sizes come from. So actually, we use the same block census from our statistical bureau. This quality or safely managed survey is quite expensive actually. So still we need a collaborative effort with our statistical agency, especially if we want to have a detailed picture in terms of inequalities, the wealthy of the household, the rural and urban population. So that's why we assure that we use the same block census. So for more detailed data, we can have we can combine data that from this safely managed water monitoring and also from our regular monitoring through our statistical bureau. Thank you, Juliet.
Great, thank you, Aisha. So we might move on to a question for Gabrielle. So Gabrielle's a multi-country project manager for their Water for Women program. And I'm interested, Gabrielle, if you could maybe talk about what kinds of both strengths or challenges you've encountered in monitoring inequalities to access to safely managed services.
Sure, thank you, Juliet, and thank you also to all the presenters. That was really interesting. Within SMV, we have standardized approaches to it. So we can have at any one point in a year, we may have up to 20,000 household surveys across multiple countries. And what we see in terms of inequalities, when we kind of disaggregate it by wealth quintiles or by the gender of the household head or whether or not that household has a person with disability, it is to be able to do that analysis at the district level. So a little bit what Rick said, to bring it down to the subnational level, gives you that nuance that the national level doesn't have. So if you can get that data and you can analyze it and break it down to show any trends, for example, in Nepal, we were seeing that female-headed households were much less likely to have household hand pumps compared to other areas. But if you can get that data in front of the decision makers, so you can present it, they can see any inequities, it makes it very visible. And you can also then influence whether or not that's included in strategies and plans and investment priorities. A challenge to it would be that we're basing it on household surveys. So the intra-household issue makes it invisible, for example, for the experiences of people with disabilities or age, for example, in the household. So when you have the household level to try and complement it with some sort of formative research or working with the DPO and networks to bring that data to the table as well with the decision makers. So you can make sure, whilst we have the limitations of a household survey, you can also try and make sure that that experience or voice is not there. But to me, bringing it down to that subnational level in front of the decision makers, depending on what the characteristic is most priority within the area that you're working with, and making sure we use this data. We can spend many, many years improving our data, but if we can make decisions and inform investments now based on that, that to me is really important.
Great, thank you. And yeah, the recurring theme in both your and Aisha's response on how we can use the data to make better decisions. So we're coming close to time. So I have just maybe one final question to put to both Aisha and Rick, if that's okay. So the Water for Women Fund includes both civil society organisations and research organisations. And just interested, from where you sit, what do you see as the best role, what's the most effective role that those types of organisations can play to support a progression towards safely managed services? So I don't mind who goes first. Just give me a nod if you are happy to jump in. Rick, okay, and I should get a bit more thinking time. Please go ahead, Rick.
Yeah, I like this conversation. And speaking about Gabrielle's point about looking at subnational inequalities, because if you think about household surveys, they're really not powered to give you very local, district level, municipality level data. But that's the kind of data that is more actionable for programming and policies. So I think what can be done to strengthen those surveillance systems, those MIS type systems, is really powerful. And I think that's where CSOs and research organizations could play a part. I like the example in Papua New Guinea of working with M-Water and showing that something can work in terms of both the technology, because you have the tablets, right? But also, more importantly, the systems, how the data are managed. That kind of work can be done at a small scale, at a district scale or a municipality scale. And if with some CSO support or NGO support or research support, it can be demonstrated that look, this is doable, it yielded useful information, it didn't break the bank doing it, then that kind of thing could be scaled up.
Yep, great, fantastic. And nice that we already have some examples of that kind of work in the fund. Great. Aisha, so what would be most helpful to you?
Yeah, for the GSO or NGO role, I think it is really important, to have a strong advocacy and understand the data also at the grassroots or the region level. I think that's really important. That's where the GSO or NGO can take part. I mean, we have the national figure, but again, the advocacy, the strengthen the awareness of the local government. It's really need, you know, support, especially maybe from the GSO, that NGO, that they are, you know, more local, talk about in a more local context, how we can move forward. And in terms of researchers, I think it's really important, like my colleague here from Universitas Indonesia is also present here. We need to, you know, develop a more collaborative effort. So what, you know, the researchers also can support the development of policy in Indonesia. Like a way forward, we already quite a clearer picture in terms of safely managed water, but not yet on sanitation. So we have been requesting, can we you know, have the same pilot for the safely managed sanitation, especially in terms of the gray water. We haven't yet talked about gray water here in Indonesia. We only still focusing on the black water. So we really want to know, like, what is the excess risk that's still, you know, in the environment, while we only talking about the septic and etc. So I think there's a lot of room for us to collaborate with GSO and researchers. Yeah, thank you.
Great, thank you. And yes, with that, we'll thank our 3 panel members. Thank you so much for the insights you've shared today, and I'll hand back to Freya.
Thanks again, that was really insightful, and I think also added to the presenters today that really presented a range of valuable examples, as well as steps of progress despite some of the challenges that they've identified. I think really we should congratulate all of the progress that has been made, and I really hope that there's action that people can take from these on how we can make progress, and some steps forward. So there might be small steps, they might be larger steps. I think we've seen a range of scales of how we can progress. So just here on the screen, we have just one small activity or that you could take home, and just to help us understand a bit better really what your priorities are going forward in monitoring, and what are the next steps that you think your organisation can take to move forward. So the link to this Menti is pasted in the chat, and also we'd also like to share the link to, on the next slide, to the report. So we've already produced the synthesis report and case studies. They can be found. I think Kate's going to present a link to the reports in the chat, and we'll be producing also another blog in the coming weeks that synthesizes some of this discussion that we've had today, and the lessons that we've learned through these various activities, as well as some of your responses from the Menti survey. So again, I'd really like to thank all of the presenters that were involved in today's workshop, as well as all of the research partners and CSOs that were involved in this learning initiative. It's been a really valuable process, and really a lot of commitment from the different organisations to develop these case studies and contribute to this work. And particular thanks to all of our presenters from World Health Organization, Bappenas Indonesia, and also from PNG in the presentation today. So I think we're at time there, 1 minute over. So I'll let people go. I know it's very late in some areas of the world, very early in the others. So I really appreciate your efforts, and please don't hesitate to reach out to myself from University of Technology Sydney, or Kate Orr from the Waterfallman Project, whether you've got any questions about this work or any further reflections on the topic. Thanks very much, and look forward to hopefully seeing you all in future efforts on monitoring and progressing monitoring safely managed services. Thank you.